I feel like I know you already, because we've been connected to each other for quite a long time, actually, through Dr. Jill Barham. So
Yeah, I know, it's funny, isn't it, with the whole, especially lockdown and everything being conducted through Zoom calls and online. It's yeah, when you finally speak to a person who's been commenting on each other's posts and all that stuff for all these years, and yeah, it's lovely to meet you virtually.
And you virtually as well. So tell me a little bit about who you are and what do you do?
So I'm Sally Varley, and I am an acupuncturist like you. And I live in a little village near Loughborough in the East Midlands, and I've got a cabin in my garden where I was doing treatments until we had to close our doors. But as we were just saying, hopefully we're reopening again very soon. So I have been in private practice for 9 years now, and in the last few years especially, my real passion has developed for helping women to balance their hormones. And I especially focus on fertility and menopause. So I have a general practice, so that means obviously that I accept pretty much anybody that asks for my help. But the cases that I really enjoy working with are women, and actually I don't know if this is the same in your clinic, but it's 99% women that come for treatments. I think men are just, they wait until something's falling off, before they pick up the phone. So, and how about you?
So I'm Emma Guy. I'm also an acupuncturist, and I have been practicing as well for 9 years. I'm also known as the Menopausal Godmother, a new avenue that I've gone down quite recently in lockdown. And the reason for that really is that all my kind of experience over the last 9 years, certainly on a private practice and a hospice experience, is all about ladies going through the menopause. And I realised on lockdown that I've probably treated in excess of 1,000 ladies going through the menopause. So what I don't know and what I've not heard is probably, I've heard every single thing and every single symptom. But like yourself, I've become quite passionate about it, so much so that 6 years ago I introduced a protocol called the Guy Protocol, which actually I have the evidence, which I'm actually using that evidence in the book I'm writing about at this precise moment in time. So yeah, we have very similar backgrounds, and we're very passionate about looking after ladies.
Yeah, I don't know whether it's the same for you, but for me, the reason I got into this particular line of work was because when we were at acupuncture college, I remember, I don't know why it just stuck in my head, but the class, when the teacher said menstrual problems are very common, but they're not normal, and we normalize them because so many people have them. But your period should just come and go. You ought to be able to conceive without any difficulty, and we should have a good, happy, healthy menopause. And yet so many people, just women, suffer for years and years and years, and it's so awful to see. And I couldn't stand it anymore, and I just want to get that message out there, like, it doesn't have to be that way. And there are lots of things you can do that will help. And I think that, Chinese medicine is so powerful, isn't it? It's such a special, profound medicine. And, the fact that it's been helping literally billions of people for thousands of years, all naturally, is just amazing. And so, we have such a skill at our fingertips, literally, that, we just want to get the message out there and help as many people as possible.
Yeah.
And what was it like for you? Why did you decide to go down the menopause route?
It's kind of one of those things that when I first started, I wanted to be this kind of cosmetic acupuncturist. I wanted to kind of, get maybe the rich and the famous, and everything would be, fantastic. And actually, it didn't work. And it was like, I think the universe was saying no. And one of my really good friends, unfortunately, has passed away now. He was diagnosed with cancer, Sean, and he was going to the local hospice for therapies, for complementary therapies, reflexology and Reiki and hypnotherapy. And he said, look, you've just qualified, why don't you volunteer at the hospice? And I suppose that's where I've kind of fell in love with the power, like you said before, the powerfulness of acupuncture and how much you could make a big difference to ladies, especially most of my patients at the hospice are breast cancer, either survivors or palliative. And, because of that, because of perhaps the chemo or the radio, because of the mastectomy, they've been plunged into a menopause, and they're like, where do I find help? And that's actually personally what happened to me, because I was surgically put into a menopause because I was diagnosed with breast cancer 4 years ago, and I had a mastectomy, and literally overnight I went straight into the menopause. So that's kind of where I've kind of shaped the last 4 or 5 years, because I know exactly how people feel now in the menopause, and it is all about the hormones, and it's educated. For me, you're absolutely on the same page with me, is educating women more about how to balance their hormones.
Yeah. And so, of course, having that very personal experience of, being thrown into it and then being treated for cancer, and surgery, that's huge, isn't it? All of that stuff. So you can bring like a wealth of knowledge and reassurance, I guess, to your clients, because they know that you really understand what they've been going through. And what was I going to say? Just to sort of backtrack a little bit, when you said that you wanted to do cosmetic acupuncture in the beginning but it didn't work, I'm imagining you're saying, because I do a bit of cosmetic acupuncture too, which I enjoy, and the treatments work, but
yes,
you're saying that
I went by, because I think when you qualify as an acupuncturist, you think, oh, what shall I specialise in? And that was, for me, I thought, oh, yeah, because I live in Cheshire, Cheshire Housewives and all that kind of, and I was completely, it wasn't that it didn't work, because I still do cosmetic acupuncture in the private clinic. It wasn't going to be my specialism.
Yeah.
That's what I'm saying. My friend Sean kind of gradually got me into that specialism of menopause, cancer care. I am known in the local areas as the baby maker as well. So I'm also, that part of fertility as well. But actually, I use the same, similar very points in fertility that I use in menopause.
Mm-hmm. Because we're still working with the same hormones, aren't we?
Exactly.
Yeah, because I was talking to a business coach the other day because I have an online program for fertility and an online one for menopause, and she was kind of saying, well, which one are you going to focus on at the moment? And then, but the problem is, well, not the problem, the great thing is that I get people contacting me regularly for either one. Yeah. And so even if I think, well, I'm just going to concentrate on this one, somebody will pop up for menopause or vice versa. But actually, when you think about it, it's just all part of the spectrum, isn't it? Of you get on at puberty and you get off at menopause, and it's not like you suddenly start dealing with a whole different set of hormones. So that's the beauty of what we can do is really just work with anybody, meet them where they're at with their health, and help them at any stage. And you know, I feel a bit sad sometimes when I might get a message from somebody saying, oh, I wish I'd met you 10 years ago, or, you know, because I think, like we were saying, there's a lot of women who are just suffering and they don't really understand how their bodies work, and they're medicating maybe with pharmaceutical drugs or alcohol or sugar. And, you know, it's easy to get into a real rut, isn't it, with your health, and just feel like, well, this is it. And we tell ourselves these stories that aren't true about how, well, it's just getting older, or it's just, you know, it's my body, or my, I saw a thing yesterday that said something like, disease runs in family because unhealthy eating runs in families. So it's not necessarily that, you know, you're just predisposed to something because your parents or your grandparents had it. It's just because people tend to have the same lifestyle, don't they?
And I think, you know, from a nutrition point of view, I'm not an expert, but you know, it's the general stuff when I'm sitting in front of patients and I talk about their diet and their lifestyle, and quite often, you know, they'll say, oh, well, yeah, I probably eat too many takeaways or whatever the case, and you kind of go, well, okay, right, you know, and just the basic stuff of 5 a day and water. I mean, I've drunk more water since lockdown than ever, and it's only because I've got the time to, you know, and it's kind of like, why don't I do this on a regular basis? You know, we're all guilty of it sometimes.
Yeah, absolutely. And exactly, and the same with fertility. I think sometimes people, they're having difficulty conceiving, they trot off to the doctor who does some tests, and they say, well, you're normal, we can't find anything wrong with either of you. And then they're just like, oh, I don't know, so the next stop's IVF or something, which obviously is a super stressful experience. It's expensive. And I was talking to someone recently who, she'd come for something else, for like a pain, but when we did the consultation, she, you know, and as an aside, she was like, oh, and I've been trying to conceive for about a year. She said exactly all the stuff you've just listed. She's like, oh no, I probably have about a glass of water a day, maybe a bit when I brush my teeth, and then I don't like to drink anything in front of clients because I think it looks unprofessional. So it's like, it's water, you're allowed to, you know. And she was sort of on her feet all day, and then she said, oh, I normally pop over the road to buy a sandwich and a packet of crisps at lunchtime. And her body was obviously so nutritionally starving. But those cases are great because actually there's so many things you can do from the get-go that are free. And I just thought, if she just sorted out her diet and her lifestyle and started sleeping properly and exercising and all that stuff, you know, she'd probably fall pregnant quite easily. And so anyway, tell us a bit more about how you developed your protocol then for menopause.
Well, it was really trial and error with certain points, and as a fellow acupuncturist, what we I suppose for anybody who's watching this, when we needle, we either even needle, or we tonify, so we turn clockwise, or we reduce, so turn anti-clockwise. And it was just playing around with some points, but mainly it was trying to find points that were away from the top of the body. So in breast cancer, we would obviously never needle on the side that perhaps there's been trauma or an operation or whatever the case may be, and I wanted something that worked from a whole body, but didn't touch anywhere near the hands or around that area. So the guide protocol really, I played around with spleen 6, spleen 9, stomach 36, kidney 3 and liver 2. So liver 2, spleen 6 and spleen 9 are all reduced, so they're turned anti-clockwise. And then stomach 36 and kidney 3 are all tonified, so they're clockwise. And the results are amazing. I've got the evidence that I've got from St Luke's in principle have agreed that I can use the evidence because it's all independent. I haven't been involved in it. Every patient was asked about it, and I asked about it independently at the beginning and at the end of treatments. And overall, there was an almost 60% reduction in hot sweats, and it was just
amazing.
It is. So I just thought, well, you know what, I've got to call this something. So I'll name it after my surname, Kai, so that, you know, I've got to be famous for something. What about you? Do you use any protocols in fertility?
I do use one or two. There's a fertility acupuncturist who actually works from the town I used to live in, over in Stamford, and she wrote a book with another practitioner a few years ago. So I use that quite a bit, particularly because they are very focused on helping people having assisted reproduction. So, you know, because this is one of the other things that I love about Chinese medicine is how bespoke it is. So you can follow protocols, but also you can really tailor it to the individual. So I like the fact that, say, on my fertility program that's online, I teach my clients acupressure points. And for people watching who won't know, all the ones that you've just mentioned, they're all on the lower leg or on the foot. So they're really easy to do on yourself. And so I think it's great because you can just, you know, communicate with somebody and say, right, you're approaching ovulation and your syndrome or your pattern is what we call liver qi stagnation, or yours might be qi deficiency or something. So there's different points for different people, aren't there? And I love being able to just make a very personalized plan for each person. So I think partly because, you know, I don't see masses and masses of clients a day. I only see one person at a time. I actually, where I studied, the guy that had he founded the school, and he was a genius. Basically, he just he had studied biochemistry, and then he did French or something, and then his biography was kind of like, oh, and then he got a bit sick of that, so he decided to go to China, and he taught himself Mandarin, and then he decided to join the TCM program, and he came top of his class in some of the writing he used to take his notes in Chinese. And so he went back to Canada, which is where I studied, and he set up this Chinese medicine school. He used to run 3 rooms at the same time. So, and obviously, like, he had a receptionist, and they would prepare the notes and stuff. But he was just phenomenal, because we used to go in and observe him, and we would have to write the notes up. And he would have a quick look before he went in, and then he would talk to the patient for a couple of minutes, and then he'd put the needles in, and then he'd go to the next room and the next, and so on. And I don't even know how he could keep everything in his head. And then at the end of the day, he would go through all the files, and then he could still say, no, I did that point, not that one, or you forgot to mention that he had a sore throat last week or something.
Wow.
He was very skilled and very experienced, and he'd been doing it for about 25 years or something by the time I met him. But I suppose the point I was trying to make was just that I'm a one client woman. I'm not even sure. I know you said you do 2 rooms sometimes. I'm not sure that.
Yeah, sometimes I do. But I only take on word of mouth new patients, so a lot of the new patients go to the team. But my regular patients, know the value of acupuncture and know that they need to keep coming back to have little regular top-ups, as I call them. So it's quite, when you've built a relationship of over 9 years with somebody, to have that shared space for a shorter period of time, you can kind of, I know this person for 9 years. They've been coming to see me, 6 times a year. So I kind of know what the cycle is. But I love when you said about Chinese medicine being so bespoke, because there's times when you think, right, okay, I know, for example, Mark comes with lower back issues, and he might turn up that day and go, well, or something's happened in the family, and all of a sudden you're going, well, I can't, there's no point in me treating your lower back, because what you need is, you need something else today. You maybe need, front points, maybe you need, nada, or whether, and I love that, because you can never ever prepare. You think you can prepare, but until you sit down and talk to that patient, you don't know what's going to come out of their mouth. But I love that they have this safe space where they can tell you literally anything and everything.
Yeah, absolutely. And I think that's why before I did Chinese medicine, I just jumped around from job to job and place to place, and I could not settle, and I just didn't know really quite what I wanted to do, and I was always having this kind of pull towards working in the health sector, and I finally landed on acupuncture. And then I never get bored of it, because it's not like, oh, here's another person with insomnia, because it, like you just said, it could be for any different reason to the previous person. So it's all about that person in the moment and what they need. And like you said, that safe space where they can just sort of say anything. And that, I love the fact that we have so much time with people, because of, again, when you go to your GP, you've got your 7 minutes to talk about one thing, and nothing, there's no joining of the dots, is there? It's just all like, let's segment the body, and we'll focus today on your I don't know, indigestion or your acid reflux, but not looking at how that fits in with anything else. And that's why people don't get better often when they're just medicating or ignoring stuff. So I'd
be interesting to know, because if I take on a new patient, I always say, the first session, you need to give yourself 60 to 90 minutes, because we'll do a full consultation, we'll do a diagnosis, a tongue and a pulse diagnosis as well. We'll confirm probably what they're telling you as well. And quite often we were taught about the CS, and I don't know whether, the causable factor, to literally go all the way back to even childhood. I was having a conversation with a lady yesterday, and I was saying, what about your childhood? Did you have a break or fall? She was like, actually, yeah, I did fall off my bike when I was like 7, and all of a sudden it kind of, that's where the causable factor happened, why she's got a sore back, and why she's had a weak back. And it's kind of, I love that you get that time just to really ask about every single part of the body.
Yeah, and sometimes people, I love it, because they'll arrive and they're like, oh, it's just one thing, and then by the end of it they're like, I feel like a complete wreck, because they've kind of unearthed all these other things that they, and again, it's all about normalizing stuff that isn't really normal. But people think, oh yeah, my nose is always blocked, it's always been like that. Well, that's not normal. If you wake up in the morning and you have to take a paracetamol every day because you always wake up with a headache, not normal, people. So so it's great that we can help, isn't it? So what do you see for the future with your book and stuff, is this something for the layperson, or is it for practitioners, or both?
It's probably a little bit of both, but mainly for ladies going through the menopause. So the purpose initially for the book was to get the Gaia protocol out there and get myself famous for it, but to also provide the evidence to show that actually acupuncture does work for menopausal symptoms. But the book itself really is kind of my story and a little bit about my journey. Certainly with the protocol, but then part of the book is about self-help from other menopausal godmothers, so people like hypnotherapists, counselling, nutrition, fitness, a place where some menopausal lady can open the book and say, do you know what, I've not tried that, like, oh right, I'll go, go and try that. And then since lockdown and setting up the Menopausal Godmother, I'm doing the website at the moment so that there will be a membership for other godmothers, and there'll be a membership for ladies going through the menopause, so that those two can be connected together. So if that person needs reflexology, for example, then they're connected to the reflexologist in that shared safe space. And then there's products as well. I've got about 6 or 7 different products already, and it's hard to believe, but it's kind of like, oh, lockdown's really focused me into, right, I know exactly. And I've written the book probably over the last year, but I've gone back again as the Menopausal Godmother, and I'm almost finished the book again, and I've rewritten it. So yeah, so it's a little bit of both. It will be kind of more evidence based at the back, but it's about kind of how you can help hold people's hands through the menopause.
Mm-hmm. Yeah, and I think that is so important, because sometimes people around us don't really understand what we're going through. I think that's true for everybody. And as a woman, you might not have a partner or a husband you might not have one full stop, or you may not have one that's very understanding. Yeah. Or you might be in a same-sex relationship and you're both going through it and both having a hard time and not really able to be there for each other. And so again, I think that's where people like you and me come in as a really helpful kind of forum for just allowing people to open up. And I think one of the other things as well with fertility in particular is that I was just talking yesterday to a doula. So anybody who doesn't know, it's somebody who they're kind of like independent midwives pretty much, who can assist you through your birth. I had a very difficult third trimester with my son, who's now 6, and I spoke to a doula because I had to spend nearly a month in hospital, and so it was quite traumatic, and was very traumatic actually, but without going into all the details. And this lady just was so reassuring and so lovely, and even though she couldn't be there at the birth of my son because she was already booked with another client, but just having somebody say, well, this is normal, or that's not, because once you get into the hospital system or the medical world or whatever, you're kind of at the mercy of all the scans and the tests and the diagnoses and stuff. And you sort of, it's quite hard to just advocate for yourself, and you need somebody in your corner. And I think on the fertility stuff, that especially for people who might be having IVF, and then they have to go and tell their boss or somebody completely random that they're having treatment, and it's very personal, or that they're getting invited to a baby shower and they just feel like they can't bear to go because it's too painful. And I think there's quite a lot of stigma around not expressing those emotions, because they're not kind of it's, you know, we don't like jealousy or envy, or people find sadness or grief or anger difficult, all the negative emotions, don't they? Which are all a normal part of a person's makeup. And so I think it's important that it made me realise that that is what I'm trying to bring to my clients, particularly on the fertility front and the menopause front, is just a safe space where they can speak freely without fear of judgment, and it's not going to get back to anybody. And, you know, they could just sit there and say, I hate my sister because she's pregnant and I'm not, or something, you know, even if that's not really truly how they feel inside, but in that moment. And yeah, I think that's really invaluable, because, you know, it's all well and good going through the IVF and the assisted techniques, but it's still a bit clinical. It's still very clinical. I think, you know, you're just, here's your drugs, off you go and inject yourself every day. There's not any of the TLC and how are you feeling or anything. So.
And you know, it's the same that I connected when I started going through the menopause after my operation. I thought, actually, let's normalise this, because it's just like puberty, but the other way around. You know, I remember putting on weight in puberty and being a bit hot-headed, and you know, and all those things, and feeling low, and okay, and it's embracing that transition that us as acupuncturists can actually really help, you know, and I always say it's almost like a healing conversation, because if you hold it in, then it's still inside you, but if you say it, and it doesn't matter what they say, if you say it, it's out there now, and they're not holding it in, they're not holding in their lung chi anymore, are they?
Yeah, and I think also with the kind of training that we have, you learn to look at a person and you can kind of see between the lines, can't you, or read between the lines, and you can, the body speaks, you know, people don't necessarily have to be aware or even verbally express something, but we are trained to notice the colour of the skin or the look in the eyes, you know, or the tongue, whatever it is that gives us so much information. And I mean, I'm not, for anybody watching, thinking, oh my God, you're going to know my darkest secrets. It's not like that. And I mean, I remember saying to, looking at a client's tongue once, and the tip of it was a bit red, which in Chinese medicine means that, you know, there might be some sort of emotional stress. And I just said to her, oh, have you had an argument with your husband or something? And she went, yes, how did you know? And she was horrified that I just kind of said it as a bit of an off the cuff thing. And so, you know, it's not that we're like mind readers or anything, it's just that we can tell certain things about your health from looking.
That's why we train for so long, because a lot of it is about theory and diagnosis, you know, and when I say to patients, you know, stomach cold is diarrhea in Western medicine, stomach hot or stomach yang is constipation. So, you know, we are very much trained in that theory to detail as a general doctor would be. And that I think sometimes does, you know, patients will say, oh, is my pulses all right? But you have to explain that, you know, what you're actually listening to. And you know, I always say to patients, you know, what I'm listening to is whether your music of your chi is in tune or not, you know, and I can hear whether, you know, your stomach chi is out of tune. So we need to boost and, you know, nourish the stomach, or whatever the case may be. You know, it's educating as much as you possibly can. I always say I like to educate some of my patients in a way that they then can educate other people to say, actually, no, it's not woo-woo, it's not modern day voodooism. It's about, you know, actually it's really, when it's practically explained, it's quite easy to understand.
Mm-hmm. And it is scientific. It's not just, I think people think that it's woo-woo because it doesn't really conform to studies that are considered significant in Western medicine, because of course you can't do double-blind controlled trial on anybody. You know if you're getting pierced with a needle or not, but it's it still, it doesn't mean that it doesn't work or that it's just placebo or whatever. Yeah. And anyway, even if it was just placebo, so what? If the person feels better, that's the aim, isn't it? So,
well, and the thing is, you just made me think about. I've got another acupuncturist who's a friend, but she used to be an electrician.
Oh wow!
And she said it's no different.
Yeah,
your body is the motherboard, and if the light or the junction isn't working somewhere, then what traditional Chinese medicine does is it finds where that junction or light bulb point is, and then unblocks it, and then gets that circuit working again. And I just thought, so absolutely bob on.
yeah, simple analogy, but it's true, isn't it? Yeah, amazing. So where do you hang out on? Are you on social media much, or where can people reach you?
Yes, yeah. So the acupuncture side, we're Acupuncture That Works clinic. We're in Northwich in Cheshire, and we have multidiscipline team down there with physiotherapy, reflexology, Reiki, massage, and also acupuncture. And then on the Menopausal Godmother, yes, or on both platforms. I'm across all the social medias, so
you're on LinkedIn,
yeah, Facebook, Twitter, yeah. I mean,
which one do you like? Which one's your favourite?
I love. What do I use most? I probably use Facebook more than what I use Instagram or Twitter. But I think that's because of the age group that it kind of lends itself more to Facebook. But then Instagram you can do a lot more with, because you can hashtag and add people in, and all that as well. So it's hard work sometimes, just getting getting the time and also getting the right message out there. What about you?
So I'm on Facebook predominantly. I also have an Instagram account, but I don't do Twitter or LinkedIn because I just find it all a bit overwhelming at times, and I'd rather focus on. I know you've got marketing experience as well as your other sort of hat, isn't it? And I've been told many times over the years to just really focus on one or two platforms and do them well, rather than spreading yourself thinly on everything and not doing any bit of that well. And same, I find I'd say the fertility clients are probably more on Instagram, but definitely the sort of menopausal women are on Facebook. And I've been using Facebook for over 10 years and I like it. I feel quite familiar with it. So so that's where I am. I've got two groups. One of them is called Healthy Hormones, Happy You, and that one is more probably for the sort of slightly younger age group, by which I mean anybody from teens up to 40. Well, teenagers won't be on Facebook, but it's probably the demographic is like maybe mid-20s to 40. And then my other one is called Naturally Managed Menopause. So like it says on the tin, it's for women who are perimenopausal or, right through to postmenopausal. And there's a bit of overlap, and I sometimes post the same thing in both groups, but I try to keep it quite focused on the different, because initially everything was in the healthy hormones group, but then I realized, well, if you're perimenopausal or if you're postmenopausal, say, you're not thinking anymore about like how to recognize when your cycle's out of balance and stuff. So it's just different needs, isn't it?
So your courses, how often do you run them, and how long are they for? The
fertility program is a 6-month online thing, and they're on a one-to-one basis. So you know, I just sort of take people on as and when, if I've got space. And I mean, I'm thinking at the moment I've got a few people on the program, and of course are going to be opening back up for treatment, so all my clients are going to be booking in, so I think the diary is going to get quite busy again soon. And then my menopause program is a 12-week thing, and same deal, it's a one-to-one, and possibly down the line I may try to do some sort of group thing, because I think that you know, not everybody wants to work in such a focused way on the one-to-one basis, or can afford to do it, because it is an investment. And you know, but maybe something that's more than just the free information as well, so it's a bit more tailored and focused. So I think that will be sort of on the books maybe later this year or early next year. But you know, life's so topsy-turvy at the moment, isn't it? I think we're all just a bit day by day and trying to see what comes. So but you know, if anybody's interested, just obviously drop me a line, and we can have a chat about my program, and I'm sure same with you, and I'll be waiting avidly to get my hands on a copy of your book when it comes out.
I will definitely send you a copy.
Perfect, that sounds really good.
Well, it's been lovely talking to you, Sally.
You too. It's because I you know, don't have any colleagues, I love to just I could chat to you all morning about Chinese medicine and everything. I love it.
The thing is, now we've connected, and you know, I think it would be good just to even just chat every now and again, and you know, because you know, it's about helping each other, but also empowering everybody with that knowledge about how powerful acupuncture is as well. So really good. So thank you, and stay safe, and we should catch up again soon.
Yeah, look forward to it. Thanks, Emma.
Take care. Bye-bye. Bye.